Explore the potential daily care regime that a patient with cystic fibrosis may be required to adhere to. Think about all the things they need to do. Cystic fibrosis affects everyone differently, but for many it involves a rigorous daily treatment regime including physiotherapy, oral, nebulized and occasionally intravenous antibiotics, and taking enzyme tablets with food. Some people with cystic fibrosis will have a feeding tube overnight. Due to the nature of CF, children with the condition need to make sure they eat extra calories and protein. Because they lack pancreatic enzymes, they lose fat and protein in their stools. In order for children to be able to fight chest infections, a healthy balanced diet is crucial. A teenager with CF needs more calories, 2,900 to 4,500 calories a day. For fatty foods, using full-fat butter margarine, frying foods, adding cream to puddings, soups, sauces etc., adding mayonnaise, salad cream and dressings to salads and sandwiches. For protein, not removing the fat from meat, encouraging oily fish, sardines, tuna, mackerel, salmon, chop up hard-boiled eggs to add to salads. For calcium, drink plenty of full-fat milk, up to 1 pint of milk daily. Eating yogurts for a snack, add extra cheese to sauces, soups, scrambled eggs and mashed potatoes. For fiber, choosing wholemeal bread, not white bread, high fiber cereals such as Weetabix, fruit and fiber or shredded wheat, dried fruit, egg currants and raisins. 85 to 90% of CF patients have a pancreatic deficiency. This means they don't pass certain enzymes from their pancreas to their intestine properly. These enzymes are essential for digesting fat, starch and protein. CF patients need to take enzyme capsules with each meal throughout the day. This will enable them to digest their food. Due to high sugar intake the child requires, extra care will need to be paid to their teeth. By brushing their teeth twice a day with fluoride toothpaste and rinsing the mouth with water after sugary snacks or drinks, will help to keep teeth healthy. Medical treatments for cystic fibrosis help clear and control infections in the lungs and digestive system. They can also be used to treat some of the other health problems related to cystic fibrosis. Medication can be taken through various methods, including inhaling into the lungs using nebulizers, taking orally or intravenously, injected. Bronchodilator drugs open your airways by relaxing the surrounding muscles, relieving tightness and shortness of breath. Antibiotics help treat or control persistent infection. Oxygen. In rare cases, some adults may need long-term home oxygen therapy. This usually involves wearing an oxygen mask or a different device at night. People who have diabetes as a result of their cystic fibrosis will need to take insulin and manage their diet to stabilize blood sugar levels. The dietary advice usually given to people with diabetes who do not have cystic fibrosis does not apply to most people with cystic fibrosis-related diabetes. Physio should start from diagnosis. For people with CF, physiotherapy helps clear the thick sticky mucus from the lungs. Chest physio is very important as this helps prevent thick mucus in the lungs from blocking the airways, which can reduce infection and prevent lung damage. There are lots of different airway clearance techniques, and a specialist CF physiotherapist will conduct an individual assessment and advise on the most appropriate technique, as well as the length and frequency of treatment sessions. The technique can change as you get older, or as the effects of the disease change. The length of treatment sessions varies according to your needs. Daily physiotherapy is usually required, and if you have a chest infection you may need to increase the amount of airway clearance you do. If there are few or no lung secretions, treatment sessions may only need to last 10-15 minutes, but if there are many then it could take as long as 45-60 minutes. The number of treatment sessions will also vary. Most people do 2 a day when well, rising to 4 a day when necessary. If no secretions are present, some people with cystic fibrosis will only need physiotherapy once a day. Children with cystic fibrosis usually do daily physiotherapy, and might need parents or carers to come into school to help them. Exercise is particularly important for people with CF because it helps clear mucus from the lungs and improves physical bulk and strength. Rigorous exercise can be tiring for individuals with CF, yet highly beneficial. Yoga, swimming, gym, physiotherapy. All children with CF should be encouraged to take part in similar physical activities. Please refer to your handout and or video link below to see a typical daily schedule in the life of a CF patient.
Created using Powtoon.